Indications for a functional leg length test are functional limb length discrepancy. Patient may present with asymmetric antalgic gait, hip pain, anterior knee pain, pes planus, or a hip hike.
Patient standing, examiner palpates the ASIS and PSIS, noting any asymmetries.
Turn around for me. Can you straighten your right knee out for me?
Asymmetry is corrected by positioning the leg in normal structural alignment. Can also place magazines under the limb to gauge how big a limb length discrepancy there is.
Indications for the true leg length test would be a true limb length discrepancy, and the patient would present with asymmetric or antalgic gait. They could also have hip pain, anterior knee pain, and this can also occur after a total knee replacement or a total hip replacement.
For the true leg length test, the patient is supine. Patient will bridge 3 times and then lower legs to the table. Examiner measures from ASIS or umbilicus to medial or lateral malleoli. A positive test would be asymmetry in the lengths.
Indications for a positive Trendelenburg sign: weak gluteus medius or unstable hip on weight-bearing side. Patient will present with a variety of compensatory symptoms.
For the Trendelenburg test, patient stands unsupported. Examiner observes the position of the pelvis. Patient then stands on one leg. A positive test would be if the contralateral pelvis drops.
Indications for a valgus stress test are medial collateral ligament tear or laxity. Patient may present with feelings of instability in the knee, medial knee pain,
Extension.
or swelling.
Examiner stands on outside of the patient's leg. Examiner stabilizes the inside of the ankle, holding the tibia in slight lateral rotation, and pushes the lateral side of the knee into valgus. The test is then repeated with the knee in 30 degrees of flexion. Positive sign: femoral tibia joint gaps on the medial side.
Indications for a Varus stress test would be LCL ligament sprain or tear, or instability, and the patient would present with feelings of instability in the knee. They could have lateral knee pain and also
For the
swelling.
Varus stress test, the patient is supine with their test knee in extension and abducted off the side of the table. The PT will sit on the treatment table, resting the patient's leg on their knee. The PT cradles the outside of the tibia with their fingers on the LCL. A Varus force is applied to the medial side of the knee in full extension. The test is then repeated with the knee in 30 degrees of flexion. A positive test would be femoral tibia joint gapping on the lateral side.